what is Alzheimer's disease? Well, Alzheimer's disease is a type of brain dementia that's usually terminal. And what's interesting about it is that the rate at which the person declines or the progression of the disease is usually quite variable. But the early signs of Alzheimer's disease usually involve short-term memory loss and also difficulty sort of attaining new information. And the person often starts to show signs of decreased abstract thinking and flexibility in their thinking. They can't plan things as well. They lose what's called executive function in their life. And one of the early signs of Alzheimer's disease is often a decline in fine motor skills. Handwriting starts to decline significantly, or the ability to dress oneself. And then as the disease progresses, you see the more obvious signs: confusion, disorientation, personality changes with sometimes irritability or aggression, uncharacteristic mood changes. The person has trouble with language. Then their long-term memory starts to go, and of course, this can sometimes involve not even recognizing familiar people in a person's life, including their own family members. Gradually, there's a decline in bodily functions, which often will lead to death. So the average survival time once a person's diagnosed with Alzheimer's is about 7 years. Only 3% of people are alive 14 years later. How common is the problem? Alzheimer's disease is now the 6th leading cause of death in the United States and much of the Western world. 1 in 8 people 65 years and older has Alzheimer's disease. Nearly 50% of people over the age of 85 have Alzheimer's disease. And of those people with Alzheimer's disease, only 4% occurs in people under the age of 65. Another 6% is in people 65 to 74. After 74, there's a huge jump. 45% of people between 75 and 84, that's where 45% of the Alzheimer's cases are, and 45% of people above 85 also have Alzheimer's disease. So age is a major risk factor. But the other thing is this: after age 65, 10 to 20% of people also have just mild cognitive impairment. They don't have Alzheimer's or a serious dementia, but they're already losing cognitive abilities. So are there different types of dementia? Yeah, there are 3 different types. There's the classic Alzheimer's disease that we're talking about here, where you get memory loss because you lose the memory chemical. You see classic signs in the brain of what's called amyloid plaque buildup and neurofibrillary tangles in the nerve cells. This is classic Alzheimer's. But there's also a vascular dementia that can occur when you clog your arteries up with too much fat and cholesterol, or your homocysteine levels are too high. So this is more modifiable, if you will. If you keep your cholesterol down and do the right things for your cardiovascular system, you're going to be less prone to get vascular dementia. And often with vascular dementia, there's some mini strokes that occur along the way, sometimes that are occurring without people realizing it. And then there's a mixed form of dementia where you have a combination of sort of classical Alzheimer's and vascular dementia, if you will. On the large macroscopic level, what's happening in the brain in Alzheimer's disease? Well, nerve cells are dying, and the connections between nerve cells, the synapses, are sort of falling off, so the transmission of nerve information starts to drop. And with that, you're getting a shrinking of some of the key brain centers, like the temporal lobe and the parietal lobe and the frontal lobe, where a lot of sort of cognitive function occurs, as well as an area called the cingulate gyrus, if you want to look that up. But what's fascinating to me is what happens at a microscopic level, right in the nerve cell itself. Nerve cells stop producing optimal amounts of a memory chemical called acetylcholine. This happens in every one of us as we get older. We make less acetylcholine. In the Alzheimer's brain, that's a hallmark feature. But in Alzheimer's, you're also seeing this buildup of this protein plaque around the nerve cells called amyloid plaque. And inside the nerve cell, eventually, certain structures break down that lead to what are called neurofibrillary tangles. So that's the classic look of the Alzheimer's brain. And then more recently, we're seeing that dolichol phosphate builds up, which is a classic sign that the sugar coating of certain proteins in the brain is occurring, a thing that we call glycosylation. So wouldn't you know that we're starting to realize now that high blood sugar levels and obesity are strongly linked with an increased risk of developing Alzheimer's as a person gets older. As your blood sugar rises, it sugar coats certain proteins and affects your insulin levels in your brain, and that can damage nerve cells in a way that's linked to Alzheimer's. And being overweight causes insulin resistance and sugar irregularities, and so obesity is linked to Alzheimer's. So this type of what we call type 3 diabetes, where the brain is affected, is now becoming something that's published a lot in the medical literature. What's interesting is, what's the genetic link with Alzheimer's disease? Well, only about 1 to 2% of Alzheimer's cases seem to be strongly genetically based. The biggest risk factor is getting older. So as you age, the risk is greater. There's other common causes for memory loss, by the way. Parkinson's disease, there's a memory loss component. A vitamin B12 deficiency can cause memory loss. Vascular thrombosis, or clogging up your arteries, as we talked about, leads to memory loss. Head injuries, post-concussion syndromes. And wouldn't you know that just in the normal aging of the brain has trouble making the memory chemical called acetylcholine. So all of us are going to be challenged at some point with sort of this loss of the memory chemical. We may not all get Alzheimer's, but we're all going to see a decline to some degree unless we do something about it. The medical treatment for Alzheimer's disease classically is to give people drugs that stop the breakdown of the memory chemical. But those drugs don't completely solve the problem. And by the time the person's on drugs like that, to a certain degree, it's almost too late. So they don't really work in the long run. All the evidence that we have points to the fact that being proactive in your daily life throughout your lifetime is the best way to decrease the likelihood that Alzheimer's and dementia will occur. Let me tell you what I'm talking about. You really need you need to be thinking about this now. A comprehensive program to prevent or arrest the problems that lead to Alzheimer's and memory loss. So you need the right diet throughout your lifetime, a diet that's not going to clog your arteries with plaque and cholesterol. You also need a diet and supplements that are going to raise the brain's level to be able to make the memory chemical called acetylcholine, and to make other memory chemicals like dopamine, which is also very important. You also need to have antioxidants. 20% of all the oxygen you use is used by the brain. And with oxygen use, you get free radical damage. Studies have shown that more antioxidants can mop up those free radicals, and there's less brain damage over time. Certain supplements also improve the transmission of nerve impulses in the brain. They need to be incorporated at a certain phase in life. And you need to also understand that certain nutrients, like certain B vitamins, have been shown to slow the atrophy or shrinking of brain cells after the age of 65. And certain supplements are linked to decreasing the buildup of amyloid plaque, the classic feature in Alzheimer's disease. So throughout your lifetime, there are certain things you need to do. And then after you're 55 years old, there's certain supplements you should add then when things become most critical to maintain acetylcholine levels and to make sure that the brain shrinkage doesn't occur at a rapid rate. You also need a lifestyle game plan. You need the right mental and physical activities to keep challenging your brain and preserve the nerve circuits that are part of sort of more lifestyle activities, if you will, that have been shown to help preserve brain function. Believe it or not, this is where the evidence is most solid. The proactive nutrition, supplementation, and lifestyle things that you do are the most important things to guard against age-related memory loss, vascular dementia, and we think even Alzheimer's disease. The problem is, most medical doctors don't emphasize this enough with their patients who already have healthy brains to help them maintain their healthy brain. So what I've done is I put it all together in a little ebook that's available right here. It's called The Nutritional Guide to the Prevention of Memory Loss and Alzheimer's Disease. For the sake of your own brain and your functional life and quality of life, I suggest strongly that you download the booklet right now. Go through it. It explains, has all the scientific references in it, showing you what dietary approach you should use, what supplements make sense at what stages in your lifetime, how they work, and what other lifestyle activities are the things that are going to help keep the neural circuits alive in your brain so you don't have memory loss and dementia as you age. Now, at machinohealth.com, you'll see my other research articles and other resources and downloads that I've created, footage from my live seminars. that will help you lead a long, healthy, functional life. All of my teaching materials and research review papers are complete with all the scientific references, so you know you're getting only evidence-based information from me that's solid and scientifically sound on any health topic that you're looking for. So you really should make machinohealth.com an ongoing, reliable resource for wellness and health information for both you and your family members. Thanks so much for watching.